When you are sick, you go to the doctor. Someone's committing a crime, you call the police. You do not call elected officials who have no science training to say what's best public policy when you're facing a pandemic.
Public health officials in Tennessee are ending all vaccine outreach efforts targeting adolescents. That's not just for vaccines that aim to prevent the spread of coronavirus, but for all diseases. The state's health commissioner, Dr. Lisa Piercy, made the decision under pressure from conservative Republican state lawmakers.
Tennessee, come for the music, stay for the polio.
I think it is a crime against humanity to sit from a position of authority and to help spread misinformation that can have deadly consequences. Our Republican leadership has not embraced and even showcased themselves getting vaccines. They have stifled the Department of Health from being able to promote vaccines in a more meaningful way.
25% of 12 to 15-year-olds are fully vaccinated right now. Less than 40% of 16 and 17-year-olds. And that's one of the reasons that Dr. Michelle Fiscus, Tennessee's top immunization official, wrote a memo that suggested some teenagers might be able to get vaccinated against COVID without their parents' permission.
But the move angered some Republican state lawmakers. And in response, Fiscus says she was fired from her position as Tennessee's top vaccine official.
Unfortunately, in Tennessee, only 38% of our population is vaccinated. There seems to be great hesitancy, and it really comes from the top. I've had colleagues who still believe that it's a hoax or that it's caused by 5G.
The Department of Health is targeting our youth. I make a motion that we bring the doctor back here, the Commissioner of Health, next month for consideration for the dissolving and reconstitution of the Department of Health in a motion, Mr. Chairman.
With the Delta variant, there are more and more folks getting sick. Our hospitals are having to reopen their COVID wings. Dr. Fiscus being fired is just the tip of the iceberg. We've been reached out to by those from the public health community and those who work for the Department of Health, and they are demoralized. They're walking on eggshells. They feel like the work that they're doing, the work they were trained to do, the oath that they swore to people, they're not able to do their job. And if they do their job, they risk being fired. You know, it's kind of odd because when I first got elected, I got my flu shot at a public event along with our Republican governor and our Republican mayor. So I'm hoping that they can stop all this nonsense and get back to the basics of keeping people safe. And the bottom line is this: stop listening to nonsense. Listen to science.